Hi all. Animals provide many benefits such as food, fiber, livelihoods, travel, sport, companionship, and education for people across the globe. Animals can sometimes carry harmful germs also, which can spread to people and cause illness. These are known as zoonotic infections or zoonosis. Zoonotic infections are caused by harmful germs like viruses, bacteria, parasites, and fungi. Animals may appear healthy even when they are carrying germs, depending upon the zoonotic infection. It is estimated that 6 out of every 10 infectious diseases can be spread from animals, and 3 out of every 4 new or emerging infectious diseases come from animals. How do germs spread between animals and people? It can be spread by direct contact with the saliva, blood, urine, mucus, feces, or other body fluids of an infected animal. Examples include petting or touching animals and bites or scratches. It can be spread through indirect contact with areas where animals live or objects or surfaces that have been contaminated with germs. Examples include aquarium tank water, pet habitats, plants and soil, as well as pet food and water dishes. It can also spread as vector borne, which is being bitten by a tick or an insect like a mosquito or a flea. It can be food borne also by eating or drinking something unsafe such as raw milk, undercooked meat or eggs, or raw fruits and vegetables that are contaminated with feces from an infected animal. It can be waterborne when drinking or coming in contact with water that has been contaminated with feces from an infected animal. Examples of zoonotic infections include anthrax, animal or bird flu, brucellosis, cat scratch fever, cryptosporidiosis, cysticercosis or taeniasis, dengue fever, Ebola virus disease, fish tank granuloma, Glanders, Hydatid disease, Leptospirosis, Nipah virus infection, Parrot fever, plague, Q fever, Rabies, or Toxoplasmosis. First about anthrax. Dr. Robert Koch proved that the anthrax bacterium was the cause of a disease that affected farm animals in his community. It was an infection by a bacteria, Bacillus anthracis. It causes skin, lung, and bowel disease and can be deadly also. Under the microscope, the bacteria look like large rods. In the soil, they exist in a dormant form called spores. These spores are very hard and survive in the soil for long years. These bacteria secrete toxins. How do animals get infected with anthrax? Domestic and wild animals can become infected when they ingest spores in contaminated soil, plants, or water. How is anthrax contracted? In humans, it can be in 3 ways. The most common is infection through the skin. Another one is ingestion of anthrax. It can cause serious fatal disease. The most deadly form is inhalation anthrax. Anthrax does not spread from person to person. What are the signs and symptoms? The incubation period may be short, from 1 to 5 days. The cutaneous or skin form of anthrax starts as a brown raised spore that enlarges and hardens. The center of the spore then shows an ulcer with formation of a black crust called an eschar. Symptoms include muscle aches and pain, headache, fever, nausea, and vomiting. Inhalation anthrax, the first symptoms are flu-like with a sore throat and headache. In a few days, the illness worsens with shortness of breath and pain in the chest or muscles. Some patients may begin coughing up blood, coma, and death follows. Gastrointestinal anthrax is the result of eating undercooked or contaminated meat. The symptoms include nausea, loss of appetite, bloody diarrhea, and fever followed by abdominal pain. Then the infection spreads throughout the body through the blood, called as septicemia, with deadly toxicity. Louis Pasteur developed the first effective vaccine in 1881. When used as a preventive measure, it is a 5-dose vaccine series given over an 18-month period. When it is used after exposure to anthrax, it is given as a 3-dose vaccine series. The anthrax vaccine is not available to the general public. It is given to people at high risk of contact with anthrax. The greatest threat of anthrax today is through a bioterrorist attack. Now, animal or bird influenza. Influenza viruses affect several different animals such as horses, cats, dogs, birds, swine and people. Influenza A viruses are divided into subtypes based on 2 proteins on the surfaces of the virus, the hemagglutinin H and the neuraminidase N. There are 18 different hemagglutinin subtypes and 11 different neuraminidase subtypes. Human infections of zoonotic influenza are acquired through direct contact with infected animals or contaminated environments. It do not spread quickly between people. Zoonotic influenza virus infections in humans may cause disease ranging from mild upper respiratory tract infections like fever and cough, early sputum production, rapid progression to severe pneumonia, then acute respiratory distress syndrome and death. Next is brucellosis. It is caused by the bacterial genus Brucella, transmitted by ingestion of unpasteurized milk or undercooked meat from infected animals. Very rarely, the bacteria may spread from person to person. Breastfeeding moms with brucellosis may pass the bacteria to their baby. Symptoms include profuse sweating, joint and muscle pain, along with fever, chills, weakness, lethargy, and headache. Next, cat scratch fever. It is caused by the bacteria Bartonella henselae. Most often results from a scratch or bite of a cat. Young cats pose a greater risk than older cats. How cats become infected? Cats can get infected with the organism from flea bites and flea droppings getting into their wounds. Cats can also become infected by fighting with other cats that are infected. The infection does not make cats sick. Symptoms begin within 3 to 14 days following infection. Symptoms include a non-painful bump or blister at the site of injury. People may feel tired, have a headache or a fever. It is not a severe illness in healthy people, but it can be a problem for young children or people with weak immune system. Cryptosporidiosis is caused by a microscopic parasite, Cryptosporidium. The parasite is protected by an outer shell that allows it to survive outside the body for long periods and makes it very tolerant to chlorine disinfection. One of the most common causes of waterborne disease in humans is Cryptosporidiosis. Cryptosporidium may be found in soil, food, water or surfaces that have been contaminated with the feces from infected humans or animals. Contaminated water may include water that has not been boiled or filtered, as well as contaminated recreational water sources. Example, swimming pools, water parks, lakes, rivers, ponds and streams. What are the symptoms of Cryptosporidiosis? It generally begins 2 to 10 days after becoming infected with the parasite. The most common symptom of Cryptosporidiosis is watery diarrhea. Some people will have no symptoms at all. In persons with healthy immune systems, symptoms last about 1 to 2 weeks. The symptoms may go in cycles in which you may get better for a few days, then feel worse again before the illness ends. Cysticercosis or taeniasis. It is caused by larval cysts or eggs of the tapeworm Taenia solium. These larval cysts infect brain, muscle, or other tissues. How do humans get cysticercosis or taeniasis? Humans get the infection after eating raw or undercooked pork contaminated with cyst of Taenia solium. When swallowed, the cyst pass through the stomach and attach to the lining of the small intestine. In the small intestine, the cyst develop into adult tapeworms over about 2 months. What are the signs and symptoms of cysticercosis? Cysts in the muscles, we are able to feel lumps under the skin. When there are cysts in the eyes, it may float in the eye and cause blurred or disturbed vision. Neurocysticercosis, when cysts are present in the brain or spinal cord. Headache is the most common symptom. Confusion, lack of attention, difficulty with balance, excess fluid around the brain, which is called as hydrocephalus, may also occur. The disease can result in death. Dengue fever is a mosquito-borne disease transmitted by the bite of an Aedes mosquito infected with a dengue virus. The mosquito becomes infected when it bites a person with dengue virus in their blood. It cannot be spread directly from one person to another person. Symptoms are mild. Serious problems include dengue hemorrhagic fever, characterized by high fever, damage to blood vessels, bleeding from the nose, enlargement of the liver, and failure of the circulatory system. The symptoms may progress to massive bleeding and death, called as dengue shock syndrome. People with weakened immune system as well as those with a second or subsequent dengue infection are believed to be at greater risk for developing dengue hemorrhagic fever. Ebola virus disease. Ebola is introduced into the human population through close contact with the blood, secretions, organs, or other bodily fluids of infected wild animals such as fruit bats, chimpanzees, gorillas, monkeys, forest antelope, or porcupines found ill or dead or in the rainforest. It spreads in the human population through human to human transmission. Ebola is a rare but deadly virus that causes fever, body aches and diarrhea, and sometimes bleeding inside and outside the body. Fish tank granuloma. It is a rare skin infection caused by Mycobacterium marinum. The organism is found in stagnant freshwater and saltwater environments, including lakes, inadequately chlorinated swimming pools, and aquariums. Infection occurs when water containing Mycobacterium marinum enters through a break in the skin. The skin infection is not spread from person to person. Fish tank granuloma presents as a slow-growing, inflamed red bump at the site. The lesion is often painful and may become ulcerated. Skin changes usually appear about 2 to 4 weeks after the aquatic exposure. The most common location for infection is the back of the dominant hand. The infection may also appear on the elbows or fingers and less commonly on the legs. The granulomas slowly increase in size and multiple granulomas may form in a line. Glanders is caused by the bacterium Burkholderia mallee. It is primarily a disease affecting horses. It also affects donkeys and mules and other mammals such as goats, dogs, and cats. Transmission occurs by direct contact with infected animals through skin abrasions, nasal and oral mucosal surfaces, or by inhalation. Signs of glanders include the formation of lesions in the lungs, which results in coughing, fever, and the release of an infectious nasal discharge, followed by death within days or months. And survivors act as carriers. Hydatid disease, also known as hydatidosis or echinococcosis. It is a serious, sometimes fatal condition caused by Echinococcus granulosis, also called as dog tapeworm. Adult Echinococcus granulosis tapeworms infect dogs and the eggs are shed in feces of these infected animals. People become infected by ingesting or swallowing the eggs. This can occur via handling dogs or objects contaminated with the eggs or from consuming contaminated food or water. The time from ingestion of the eggs to developing symptoms of Hydatid disease can range from months to many years. The larval form of the tapeworm may lodge in various body sites where they form a fluid-filled sac known as a hydatid cyst. Leptospirosis is caused by bacteria of the genus Leptospira. It is spread through the urine of rodents and farm animals. They may not have any symptoms, but they can be carriers. They can invade human body through breaks in skin like scratches, open wounds or dry areas. It can also enter through nose, mouth or genitals. Human to human transmission is rare. Leptospirosis can lead to kidney damage, meningitis, liver failure, respiratory distress and even death. Nipah virus infection. The natural reservoir of Nipah viruses are fruit bats, which show no signs of infection. Nipah viruses are transmitted through contaminated food or directly between people. Human illness consists of fever, myalgia, severe headache and signs of encephalitis. Even death can result. Parrot fever, it is caused by Chlamydia psittaci, a bacteria. The infection is also known as Cysticercosis. It is transmitted by handling an infected bird or breathing in fine particles of its bodily excretions. Infected birds don't show any sign of illness. Human to human transmission is extremely rare. In humans, the symptoms are fever, headache, chills, muscle pain, cough and sometimes breathing difficulty or pneumonia. Cysticercosis can be mild, moderate or severe. Some people may have no symptoms. The complications include inflammation of the brain or heart. Plague is caused by Yersinia pestis bacteria. It was known as the Black Death. Plague is transmitted by the bite of infected fleas of rodents. Incubation period is 1 to 7 days. The symptoms include sudden onset of fever, chills, head and body aches, weakness, vomiting and nausea. Q fever is also called as quarry fever. Bacterial infection caused by Coxiella burnetii. It is most commonly found in cattle, sheep and goats around the world. Q fever is transmitted by inhaling dust particles contaminated by infected animals. It can occur by drinking unpasteurized milk also. The bacteria cannot be spread directly from one human to another. The disease may cause mild symptoms. Many people have no symptoms at all. Chronic Q fever is very serious because it can damage a person's vital organs including heart, liver, brain and lungs. Rabies. It is a fatal but preventable viral disease. It can spread to people if they are bitten or scratched by a rabid animal. Rabies is mostly found in wild animals like bats and foxes. However, most rabies deaths in people around the world are caused by dog bites. The incubation period for rabies is typically 2 to 3 months, but may vary from 1 week to 1 year, depending upon the location of virus entry. The closer the bite is to the brain, the sooner the effects appear. Initial symptoms of rabies include a fever with pain at the wound site. The rabies virus infects the central nervous system. Fatal inflammation of the brain and spinal cord will develop, which ultimately results in death. There are two forms of the disease rabies: furious rabies and paralytic rabies. Furious rabies results in hyperactivity, excitable behavior, hydrophobia or fear of water, and sometimes aerophobia or fear of fresh air. Death occurs after a few days due to cardiorespiratory arrest. Paralytic rabies accounts for 20% of the human cases. This form of rabies runs usually longer course than the furious form. Muscles gradually become paralyzed, starting at the site of the bite or scratch. Then a coma slowly develops and death occurs. Rabies can be prevented by vaccinating pets, staying away from wildlife, and seeking medical care after any potential exposure. It is preventable. Toxoplasmosis results from infection with the Toxoplasma gondii, a parasite. Infection usually occurs by eating undercooked contaminated meat. Exposure from infected cat feces or mother to child transmission during pregnancy. Toxoplasmosis may cause flu-like symptoms, but most people never develop signs and symptoms. For infants born to infected mothers and for people with weakened immune system, toxoplasmosis may cause serious complications which may include hearing loss, mental disability or serious eye infections. Congenital toxoplasmosis increases the risk of fetal death or premature birth. Also, if toxoplasmosis affects the eyes of a person with a weakened immune system, there may be blurred vision, spots in the field of vision, eye pain and extreme sensitivity to light. And if toxoplasmosis affects the lungs, there can be shortness of breath, fever, a dry cough, coughing up of blood and eventually respiratory failure. What to do if you have a zoonotic infection? Contact a medical professional as soon as possible. Have the animal thoroughly checked by a veterinarian to make sure that they are vaccinated and don't have rabies or other zoonotic infections. What can you do to protect from zoonotic infections? Keep hands clean. Wash your hands right after being around animals, even if you didn't touch the animals. Avoid bites and scratches from animals. Prevent bites from mosquitoes, ticks and fleas. Good sanitation and hygiene during food preparation. Eliminating cross contamination of foods. Cooking all foods of animal origin to safe temperatures and thoroughly washing vegetables before eating. So prevent the next pandemic. In this time of crisis, thousands of guidelines have already been published about COVID-19. This presentation considers the root causes of the emergence and spread of zoonosis to prevent future disease outbreaks. Thank you.